Hi everyone, good day to all. In this video, we are going to discuss 20 sure short questions from the topic of mental health nursing, which is very important for all central government exams and also for state government exams like DHS, DME, etc. Please subscribe to this channel for getting more topic wise questions and option discussions in all the important topics in nursing area. So the first question will be, which type of amnesia commonly seen after ECT? The amnesia commonly seen after electroconvulsive therapy. Option A, retrograde amnesia. Option B, andrograde amnesia. Option C, para-amnesia. And option D, dissociative fugue. See, I already told you that we are not just asking a question and giving answer for that question and moving on. Not like that. We will discuss all the four options if it is important for your examination point of view. We will discuss all the four options, and by that, watching this 20 questions video, you will get at least 80 plus facts from this video. So let's see this question: which type of amnesia commonly seen after ECT? So amnesia, we have to know what all are the different kinds of amnesia. So amnesia occurs normally due to an event of trauma. Consider this point as the event of trauma. And if a person cannot remember anything that is happened before this event of trauma, or a person cannot remember anything happened in his past, that is known as retrograde amnesia. And next one, if this person cannot remember anything that is happened after this event of trauma, the trauma occurred in his life, and he can remember his past, but he cannot recall or remember anything that is happening in his day-to-day lives or his present life. That is known as andrograde amnesia. And what is paramnesia? Paramnesia is just a delusion, a memory based delusion. See, a person cannot remember an event. He cannot remember an event from his memory, which is just his memory or imagination. He recalls an event from anything happened in his past. He recalls that incident, but he cannot differentiate it between just is it my memory or is this just an imagination. He cannot differentiate between that. That is called para amnesia. And one best example is deja vu. You know what is deja vu is. And next one is option D, dissociative fugue. What is dissociative fugue? In dissociative fugue, a person completely forgets about his personality. He cannot remember anything about him, his name, his family members, his friends. He completely forgets all that, and he just start to wander or just traveling. That is dissociative fugue. A person forget his past and identity and just travel in the world in a new identity or something like that. That is dissociative fugue. So for this question, which type of amnesia commonly seen after ECT, the answer will be retrograde amnesia. Retrograde amnesia is the answer. Next question. The following delusions are common in depression except option A, delusion of poverty, option B, delusion of nihilism, delusion of grandeur, and delusion of persecution. This is very easy question. Actually, in depression, everything will be negative because the person is depressed. He cannot show any signs of maniac symptoms like that. So in these four options, the three options will be negative or depressed symptoms, and one option will be something maniac. So let's find out which is maniac. Option A, what is that? Delusion of poverty. Poverty means the person assumes he is poor, or he don't have money, or he don't have anything, he doesn't have anything to eat, like that. That is delusion of poverty. So poverty, poor. So that's not a positive, or that's not a maniac symptom. That's a depressed thing. So delusion of poverty is a delusion of depression. It happens in depression, so it is not the answer. Next, delusion of nihilism. What is delusion of nihilism? In delusion of nihilism, a person thinks that he is dead, or he is not existing, or even the world is not existing. He thinks like that. So that is delusion of nihilism. That's also a negative symptom, because he thinks that he's dead, he is not existing. So that's a negative thing. So that's also seen in depression. Next one, delusion of grandeur. What is that? In delusion of grandeur, a person thinks that he is very important, he is an eminent person. That is delusion of grandeur. He may think that he is the prime minister or president, something like that. So that is a positive thing, right? That's mania. He thinks that he is very important. That does not occur in depression. So that is the answer. These three options, A, B, and D, are common in depression, but the except one, that is delusion of grandeur. Delusion of grandeur is the answer. So that's it. Delusion of grandeur is the answer. And just discuss what is delusion of persecution. The person thinks that somebody is going to hurt him or kill him. That is delusion of persecution. So the following delusions are common in depression, except the answer is C, delusion of grandeur. Let's move on to the next question, that is the organ which is not affected by lithium toxicity. This is a straight question. The only one organ in the body that is not affected by lithium toxicity. The answer is option D, liver. Liver is the answer. Rest of the three organs, pancreas, kidney, and small intestine, will be affected by lithium toxicity, but liver never affected by lithium toxicity. So the option D is the answer, liver. Let's move on to the next question, that is which electrolyte imbalance enhance lithium toxicity? So the question number 4, which electrolyte imbalance enhance lithium toxicity? The electrolyte imbalance which increases lithium toxicity. Option A, hyperkalemia, B, hypokalemia, C, hypernatremia, and option D, hyponatremia. Here the electrolyte imbalance which increases the lithium toxicity is hyponatremia. Option D, hyponatremia, is the answer. How hyponatremia increases lithium toxicity? See, the valency of sodium and lithium is plus. Okay, they are both are cations, and kidney considers these both cations, lithium and sodium, as similar. So if hyponatremia occurs in the body of a person, what will the kidney tries to do? Kidney will try to retain sodium. So it will not excrete much sodium, and it tries to retain the sodium in the person's body. In similar fashion, it also retains lithium. If there is hyponatremia in the body, kidney retains sodium and also lithium. So if it will increase lithium toxicity. So if there is hyponatremia in the body, it will increase or enhance lithium toxicity. So hyponatremia increases lithium toxicity. That is the answer. Option D is the answer. And let's move on to the next question. That is omega sign seen in option A Alzheimer's disease, option B depression, option C mania, and option D hyperthyroidism. Omega sign is seen in. It's a straight question. Omega sign seen in B depression. This is omega sign. Ohm, you know the symbol of ohm. This is omega sign. It will be seen in the forehead of a depressed person. The wrinkles in the forehead of a depressed person. That is omega sign. And it is seen in depression. Option B is the answer. So, common cold of psychiatry. Question number 6. A. Schizophrenia. B. Glandular fever. C. Depression. And D. Obsessive compulsive disorder. Here, the disease which is known as common cold of psychiatry, or the most common psychiatric condition, it is C. Depression. Depression is the answer. Depression is known as the common cold of psychiatry. Okay, moving on to the next question. What is glandular fever? Glandular fever is also known as mono or kissing disease. It is an infectious disease, not a psychiatric condition. It's an infectious disease which is caused by the organism EBV, or what is that is Epstein-Barr virus, EBV. So glandular fever is an infectious condition caused by Epstein-Barr virus or EBV. It's an infectious disease. So that is glandular fever. So answer for question number 6 is C, depression. Next question. Eugene Bleuler's characteristic symptom of schizophrenia include all of the following except Bleuler's 4A. You know what is Bleuler's 4A is? There is ambivalence, autism, affective disturbance, and loosening of association. So the except one will be apraxia. Option D, apraxia is the answer. Bleuler's 4 negative symptoms of schizophrenia. Ambivalence, that is mood swings. Mania and depression, that is ambivalence. Patient will have both the moods. He may be very happy at one point and very sad at another time of point. So that is ambivalence. And autism. Autism, what is autism? In schizophrenia, autism is like patient chooses fantasy over reality. That is autism. Patient chooses fantasy over reality. That is autism. And next is affective disturbances. That is the emotional disturbances. And what is loosening of association? Loosening of association means the loosening of association between thoughts. That is loosening of association. So that 4 are the 4 A's of Bleuler's characteristic symptoms of schizophrenia. Apraxia is not a characteristic symptom of schizophrenia by Bleuler. So the answer is D, apraxia. Next question. The absolute contraindication for ECT is. Let's check the options. Option A, pacemaker. Option B, increased ICP. Option C, pregnancy. And option D, liver damage. Here in this question, let's check the options one by one. Option A, pacemaker. We can give ECT to patients with pacemaker. We can give. And option B, increased ICP. If the ICP is higher than a certain point, we can't give ECT to that patient. Option C, pregnancy. Pregnancy is not an absolute contraindication for ECT. And liver damage. Liver damage is also not an absolute contraindication for ECT. So absolute contraindication means we can never give ECT to that patient. There are two types of contraindications: absolute contraindication and relative contraindication. In relative contraindication, we can by adjusting the patient's condition, by maintaining the patient's condition, we can consider ECT. but in absolute condition we will never give ECT. So the absolute contraindication for ECT or electroconvulsive therapy here in this question is option B is the answer, increased ICP. And just remember that pheochromocytoma is also an absolute contraindication for ECT. But generally this increased ICP is asked. Moving on to the next slide. That is question number 9. The situation in which individuals have excessive worry or belief that they are suffering from a physical illness despite lack of medical evidence is known as. So we know the individual have excessive worry that they are suffering from a physical illness, but there will be no medical evidence. All the investigations will be negative, normal, but patient thinks that he is having some serious illness, and that is known as what? That is known as somatoform disorder. Option D is the answer. And let's check another options. What is phobic disorder? Phobic disorder is a phobia or anxiety arised due irrational fear. It's an irrational fear to some objects, sight of some objects. Patient may have fear to flowers, patient may have fear of insects, patient may have fear of light, whatever it is. That is phobic disorder. And next is dissociative disorder. Dissociative disorder is a disconnect from thought, memory, or identity. That patient will have a disconnect from his thought, his memories, his thinking, identity, anything. That is dissociative disorders. And one example is dissociative personality disorder, dissociative fugue. They are the examples of dissociative disorder. So that's another thing. And projection. Projection is not a psychiatric disorder. Projection is a coping mechanism. That's in psychology. Projection is a coping mechanism. And in projection, the inability of a person or his lack of ability is projected to others, that he is attributing his failures, reason for failures or reason for his inabilities to others. That is projection. If a person cannot perform well in his football team and he is not selected to the main team, he is telling that they will not consider me in that group because my caste is this, or I am not rich, like that. That is projection. And next, D. What is D? That is the answer. Somatoform disorder. Somatoform disorder. The situation in which individuals have excessive worry or belief that they are suffering from a physical illness despite the lack of medical evidence. That is somatoform disorder. The fear of disease, fear of having a serious, anxiety of having a serious illness, anxiety of having a illness, any kind of illness without physical symptoms, like he may complain about severe pain in some area or fatigue, but there will be no evidence, medical evidence for that. That is somatoform disorder. And next question. According to Kubler-Ross theory of grief, which among the following behaviors observed in stage 2? Option A, depression. Option B, anger. Option C, bargaining. And option D, denial. Kubler-Ross grief stages. What are the grief stages of Kubler-Ross? First one is denial. Second one is anger. Third one is bargaining. And fourth one is depression, and fifth one is acceptance. Fifth one is acceptance. So that's first denial, second anger, third bargaining, fourth depression, and fifth is acceptance. So here Kubler-Ross theory of grief, second stage is the anger. Anger is the answer. Next question. In psychoanalytic terms, obsessive compulsive theory is fixed at fixation of different kinds. If we know that according to Freud, if the stages different, there are different stages: oral, anal, genital, oedipal, different stages of development, and if they are not developed accordingly, or if they are not developed properly, the patient may get any psychological or psychiatric disorders due to that. So here obsessive compulsive disorder or OCD is fixed due to improper development of which stage? That's what they are asking. Improper development of which stage is leading to OCD, obsessive compulsive disorder? The answer will be option D, anal stage. Option D, anal stage is the answer. Hysteria. Hysteria is also developed in anal stage. So OCD, hysteria is also developed in anal stage. OCD, hysteria, perfectionism, messiness, these all are developed in anal stage. And let's check another stages. There is nothing like Oedipal stage. Oedipal complex is there. This is not a stage of development. Oedipal complex is a feeling of poise towards his mother. That is Oedipal complex. That is identify mother as an opposite sex. That is Oedipal complex. So that is, this is not a stage. And let's check the genital stage. In genital stage, if it is not developed properly, the patient will have unsatisfactory relationships, impotence, psychiatric impotence, that is inability to make offsprings or make children. So unsatisfactory relationship, impotence, premature ejaculation, that all in genital stage. And in oral stage, if oral stage is not completely developed, there will be smoking, overeating, obesity, alcoholism, nail biting, drug addictions, etc. Smoking will be there, alcoholism will be there if oral stage is not completely developed. And OCD is fixed at anal stage. Option D, anal stage is the answer. Next is question number 12. Best test for diagnosis of organic mental disorder is option A, Bender-Jesal test, option B, sentence completion test, option C, Rorschach test, and option D, thematic appreciation test. Here the test for diagnosis of organic mental disorder is Bender-Jesal test. Bender-Jesal test is the diagnosis test for organic mental disorders. Let's see other options. The sentence completion test. It is for personality. It is for finding out personality disorders. Personality assessment. That is sentence completion test. Next, Rorschach test. Rorschach test is also used for personality assessment and also for emotional assessment. Rorschach test is used for personality assessment and emotional assessment. And next, thematic appreciation test. Thematic appreciation test is used for individual perception, finding out the individual perception and interpersonal relationships. So that is thematic appreciation test. So the diagnosis test for organic mental disorder is Bender-Gesalt test. Next, question number 13. Indian Mental Health Act was passed in the year 1912, 1947, 1982 and 1987. Indian Mental Health Act was passed in the year 1987. Here 1982 is also important. It is the year in which Indian Mental Health Program launched. Indian Mental Health Program is launched in the year 1982. But Indian Mental Health Act was passed in the year 1987. So answer will be option number D, 1987. Next question. Doctor shopping is the characteristics of hypochondriac disease. Which defense mechanism is the root of this behavior? Doctor shopping. That is, what is hypochondriac disease? A person thinks that he is having a serious illness, and doctor shopping, he is doing doctor shopping, that is, he is consulting doctors by doctors. One week he is consulting a doctor, and next week he is moving into another doctor. That's doctor shopping. So which defense mechanism is that? The answer is option A, denial. That is, the person thinks that he is having a serious disease and is denying the existence. He is showing the defense mechanism of denial. That's why he is going doctor by doctor. So that is, denial is the answer. Let's see other options. The compensation. These three are also defense mechanisms. First one, compensation. Compensation is a person compensate his weakness in one area by excelling or performing well in another field. For example, if a person is very weak in his studies, he is compensating it by excelling or performing well in football. That is compensation. And next one is displacement. Displacement is redirecting the negative feelings to less threatening subjects. A person has some negative feelings and he is redirecting that negative feelings to some less threatening subjects. And next one is identification. Identification is the adopting the behavior or character of others. So that's these four defense mechanisms, and in this question the answer is denial. Question number 15. The most common type of hallucination seen in schizophrenia patient is option A, auditory hallucination, option B, visual hallucination, option C, tactile hallucination, and option D, olfactory hallucination. The most common type of hallucination seen in schizophrenia, answer is option A, auditory hallucination. Auditory hallucination is the answer. And tactile hallucination is also seen in schizophrenia, but the most common hallucination in schizophrenia is auditory hallucination. And let's see other options. Visual hallucination. Visual hallucination is normally seen in delirium patients, commonly seen in delirium patients. It also seen in brainstem lesions and alcohol intoxication patients. And next is tactile hallucination. Tactile hallucination is commonly seen in illicit drug users like LSD, MDMA, cocaine users. There will be tactile hallucination. And regarding mental conditions in mania and severe depression, there will be tactile hallucination. And also some medical conditions like Parkinsonism, there will be tactile hallucination. And next one is olfactory hallucination. In olfactory hallucination, it's also known as dysomia. The olfactory hallucination more commonly seen in some infections of affecting the ENT. So that is regarding olfactory hallucination. So the most common type of hallucination seen in schizophrenia is auditory hallucination. Option A is the answer. Next question. 16. First rank symptoms of schizophrenia was described by option A. William Wundt, B. Eugene Bleuler, C. Schneider, and D. Ivan Pavlov. The first rank symptoms of schizophrenia, FRSS, is described by option C. Schneider. Schneider described the first rank symptoms of schizophrenia. And let's see other options. William Wundt. William Wundt is known as the father of experimental psychology. William Wundt is known as the father of experimental psychology. And regarding Eugene Bleuler, we know that 4 A's of schizophrenia, 4 A's symptoms, negative symptoms of schizophrenia. We have already discussed that is put forward by Eugene Bleuler. And next one is Schneider. We already said that first ranked symptoms of schizophrenia was described by Schneider. And Ivan Pavlov. Pavlov is one of the pioneers in the experiments of classical conditioning. So that's it. And next one is question number 17, and that's Russell sign. Russell sign is seen in, this is a straightforward question. Question number 17. Russell sign is seen in pancreatitis, otitis media, bulimia nervosa, and anorexia nervosa. The answer is bulimia nervosa. What is the difference between bulimia nervosa and anorexia nervosa? In anorexia nervosa, the affected person will not eat because he thinks that he is overweight. But in bulimia nervosa, patient used to binge eat, and after that he may get anxiety and try to vomit. So due to continuous or repeated vomiting, there will be discoloration, laceration in back of their fingers and knuckles of their hand. That discoloration or laceration is known as Russell sign. So Russell sign is due to repeated vomiting in bulimia nervosa patients. So the Russell sign is seen in option C. Bulimia nervosa is the answer. Next one. Cluster C personality disorder include option A. Avoidant personality disorder, option B. Histrionic personality disorder, option C. Paranoid personality disorder, and option D. Narcissistic personality disorder. Cluster C personality disorder. There is different kinds of personality disorder: cluster A personality disorder, cluster B personality disorder, and cluster C personality disorders. The cluster A personality disorder consists of, first let's see what is the answer for this question. Cluster C personality disorder seen in option A, avoidant personality disorder. Option A, avoidant personality disorder is the answer. Let's see. Of cluster A personality disorder includes paranoid, schizoid, and schizotypal personalities. Paranoid, schizoid and schizotypal personality disorders. Cluster A. Cluster B personality disorders include histrionic personality disorder, narcissistic personality disorder, antisocial, narcissistic. That person thinks that he gives very importance to him, that is narcissistic personality disorder. So that all includes in cluster B personality disorder. And cluster C personality disorder. Cluster C personality disorder, there will be avoiding dependence, OCD. OCD will be there, avoidance will be there, dependence will be there. So avoidant personality disorder comes under cluster C personality disorder. Histrionic personality disorder, cluster B personality disorder. Paranoid personality disorder, cluster A personality disorder. Narcissistic personality disorder, cluster B personality disorder. So that's it. Moving on to the next question. That's question number 19. The action of antipsychotic will be established within A 1 to 2 weeks, B 3 weeks, C 2 hours, and D 5 to 7 days. The action of antipsychotic drug, not antidepressants, is antipsychotic drugs. The action of antipsychotics will be established within option B. 3 weeks will be the answer. 3 weeks. The action of antipsychotics will be established within 3 weeks. And next question, that is the 20th question. Fear of thunderstorm and lightning. Fear of thunderstorm and lightning. This is the question from phobia. There are different kinds of phobia. 4 types of phobias are the given, and the fear of thunderstorm and lightning. Let's see what are the options. Option A, anthrophobia. What is anthrophobia? Anthrophobia is the fear of human beings. Anthrophobia is the fear of humans. And what is xenophobia? Xenophobia is the fear of strangers. Fear of strangers. And what is brontophobia? Brontophobia is the fear of thunderstorm and lightning. You may have heard it as astrophobia. Astrophobia, not astrophobia. Astrophobia is the fear of stars and sky. That is astrophobia. But astrophobia is the fear of thunderstorm and lightning. That is astrophobia. It's otherwise known as brontophobia. Brontophobia. And next one is this is not anthphobia. This is anthophobia. 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 Anthophobia is the fear of flowers. Anthophobia is the fear of flowers. So that's it. These all are the 20 questions we have discussed.